Hi, my name's Amy Faulkner. I'm the clinic lead for the Community Continence service at Monash Health, which is a public health service in Victoria, Australia. And I'm just talking about our group education session that we implemented a couple of years ago and looking at the acceptability and impact of that. As everyone working in public health will know, there's ever increasing demand on our service with often a reduction in funding that it makes us look at how we can do things differently and consistently evaluate our services so that we can ensure we provide the best service to our clients as quickly as possible, but also managing that in the most cost-effective way. So we introduced a group education session as the entry point to our service a couple of years ago, and we designed the class to be delivered by a junior physiotherapist or an enrolled nurse to help with that cost benefit of running the class. And the benefit of the class was to hopefully improve or decrease wait times to attend our clinic for our clients and hopefully engage them in their client journey that little bit sooner. The aims of the class were to provide education around healthy bladder and bowels and their pelvic floor muscles, to teach the clients some basic self-management techniques and interventions that they could implement prior to their individual appointment. The clients were also assisted to complete their goal chart, their outcome measures, and also taught how to complete a bladder diary so that they could complete that and bring that to their first individual appointment as well. And with the aim of the class, again, to reduce the waiting times for our service, but also to hopefully, if we engage those clients through the class, that we might be able to reduce that DNA or that non-attendance to those individual appointments that are obviously much more costly to our service. In terms of eligibility, basically the clients who were able to physically attend the clinic and who were able to understand English were able to come to the class. In terms of our data collection, we measured at 2 points, which was prior to implementing the class and then 2 years post-implementation. And we looked at patient feedback at the end of the group session and then at their first individual appointment as well. At the information we found at the end of their group session was that majority of clients found or strongly agreed that the class was interesting, that the information was relevant and easy to understand, which is fantastic. And we found that all of our clients completed their outcome measures correctly. At their one-on-one appointment, we looked at a couple of different things, and what we found was that majority of clients came with a properly completed bladder diary, which is always much more helpful at those initial appointments, and that 78% of clients had also implemented some of those self-management techniques and had found improvements in their symptoms prior to their first appointment too. There's some other results here that I just want to highlight that there's a reduction in EFT across that 2-year period with an increase in referrals to service. And the other point to highlight is that when the group was implemented, the wait time for the group was less than what it was when the clients had to wait for that initial appointment. So they were getting seen much faster. The other part that we found that was really interesting was for those clients that didn't attend the group, 60% of them also did not attend their first individual appointment. Whereas compared to those who did attend the group, only 9% of them did not attend their individual appointment. So that showed us that those ones that are DNAing at the group session are much more likely to not attend their first appointment, and given the cost of those individualised initial assessments, it's really important that we changed how we manage those clients that were not attending the class. So in summary, the class we implemented was well received by patients. It provided them with some self-management strategies that they implemented prior to their individual appointment. Non-attendance to the group may predict non-attendance to their individual appointments, and that majority of clients were bringing a properly completed bladder diary to their individual continence assessment sessions, which increased the available time for clinicians in that initial assessment to work on other aspects of their treatment and assessment. The other thing that we found this year in the strange COVID year that has been is that we've had to move our classes to an online format now, which has actually been a really great benefit for a lot of clients, for those that couldn't attend the clinic either from physical limitations or potentially work constraints, etc. So now we're looking at keeping that as an ongoing aspect of those groups as well. So definitely some things to look at moving forward. Thank you for your time.